Hi, my name is Laura Montgomery, and this is the Module 1 assignment for the lungs and how asthma affects the lungs for adult health too. There are a few questions that are asked of this assignment, and the first one is to describe the process of inhaling and the effects of the lungs, and describe the process of exhaling and the effects on the lungs. So the respiratory tract is divided into two parts, the upper and lower. The upper respiratory tract contains the nose, the mouth, the pharynx, the epiglottis, and the trachea. And the lower respiratory system contains the bronchi, bronchioles, alveolar ducts, and the alveoli. The primary purpose of respiration or the respiratory system is gas exchange, which involves the transfer of oxygen and carbon dioxide between the atmosphere and the blood. So the body depends on adequate perfusion to distribute oxygen throughout the blood, but can only do so when the respiratory system is functioning properly. The lungs are the two major organs of the respiratory system. They sit to the left and the right of the heart within a space called the thoracic cavity, which is protected by the rib cage. The diaphragm, which is located at the base of the lungs, is the major muscle in respiration. It is a large dome-shaped muscle which contracts rhythmically, continuously, and usually involuntarily. The other parts of the respiratory system, such as the trachea and the bronchi, conduct air into the lungs, while the pleural membranes and the pleural fluid allow the lungs to move smoothly within the cavity. The process of breathing or respiration is divided into two distinct phases. The first phase is called inspiration or inhaling, which when you inhale, it fills the lungs and the diaphragm contracts, which pulls downward. At the same time, the muscles between the ribs contract and pull upward. This increases the size of the thoracic cavity and decreases the pressure inside. As a result, the air fills the lungs. The second phase is called exhalation or exhaling. When the lungs exhale, the diaphragm relaxes and the volume of the thoracic cavity decreases while the pressure within it increases. As a result, the lungs contract and the air is forced out. So we are asked to make a model. And so this would be like an example, this would be the trachea, which branches out into the bronchial tubes. And so you have your right and your left lung. And this purple would be the diaphragm. So when you're inhaling, like taking a breath in, the diaphragm will pull down, which fills the lungs, which you can see. So the air comes through the nose, down the trachea, through the bronchioles, into the lungs, and then into the alveoli sacs. And then that's what will fill the lungs. And then when you exhale, the diaphragm moves up, releasing the air from the lungs back out through the mouth or through the nose. So inhale, exhale, inhale, exhale. And then why do some people have larger or smaller lung capacities? Lung capacity or total lung capacity is the maximum volume of air in the lungs after inspiration. Most healthy adults have an average lung capacity of about 6 liters. But factors such as age, body compensation, ethnicity are all factors that can range the individual's lung capacity. So for example, like males are usually a lot bigger than females. So when they breathe in, they have a more broad area of expansion and usually bigger lung capacity. Individuals that are taller also have sometimes a longer or more broad torso, giving them a bigger lung capacity of somebody that is shorter in stature. And then how asthma affects the lungs. There are several diseases that affect the lungs, and one of them is asthma. Asthma is a disease that causes inflammation and narrowing and increased mucus production in the airways, leading to the lungs swelling and tightening, called bronchoconstriction. It gets harder to breathe because the smooth muscle around the airway squeezes tightly and swells. The airway will make more mucus along the airway passage, which makes it even harder to breathe. These changes trigger responses that can cause coughing and wheezing. Asthma can be brought on by triggers such as allergens like pollen, pet dander, pollution and smoke. Some perfumes actually can cause a trigger for asthma, and exercise can induce asthma. There are some medications that can trigger asthma as well, which are the beta adrenergic blockers that are nonspecific, NSAIDs, aspirin, and preservatives like sulfites. There's no cure for asthma, but it can be controlled by knowing what triggers the asthma and ways to avoid those triggers. Symptoms of asthma exacerbations include shortness of breath, coughing, wheezing, and chest tightening. The signs of asthma exacerbation include agitation, increased respiratory rate, increased heart rate, and decreased lung function. The use of accessory muscles and the ability to talk in sentences or even say phrases may or may not be present depending on the severity of the exacerbation. Severe exacerbations of asthma are potentially life-threatening and require immediate care, close observation for deterioration, and frequent treatments. As the nurse, it is important to assess the patient's vitals, especially lung sounds and oxygen levels and heart rate, while assessing signs for cyanosis, pursed lips, and then chest retraction. Oxygen can be measured by using pulse oximetry, and arterial blood gases can be drawn, which can help determine if a patient is in respiratory acidosis. It is important to also try to keep the patient calm, reduce their anxiety. It's also important that the nurse stays calm so it doesn't induce, even further anxiety in the patient. And then have the patient sit in a high Fowler's position, which allows them to breathe better than laying down so they don't have that pressure on their chest. And then administer medications such as beta antagonists, long-acting beta agonists like salmeterol and formoterol, which opens the airways by relaxing the smooth muscles, inhaled corticosteroids like Flonase, and then short-acting bronchodilators like albuterol or epinephrine. Oral corticosteroids can be used, and they help with inflammation, and an example of that is prednisone. And then combination inhalers that have both corticosteroid and long-acting beta agonists like Advair or Brio, which I actually have an example of because I have that inhaler. So this is a Brio combination inhaler, which has powder and then the corticosteroid. And then what's important to teach the patient with asthma? It's important as the nurse to help the patient understand that the triggers of their asthma, and so like examples would be exercising. Exercising can induce asthma. If they have pets in the house, making sure that they're bathed and clean to reduce the dander or the hair. And then teaching the patient about taking the inhaler or the short-acting medications before exercise, at least 15 minutes before exercise, to help open up the airways to reduce the inflammation. It's important for the patient to understand the peak expiratory flow rate, which can be used to help detect a potential asthma attack. There are 3 zones. So there's green, which is the good zone, which you're okay. Yellow, which is like caution, so it's a potential. There's a potential risk an asthma attack may occur, so it's important that the patient take medication for 1 to 2 days, and then follow up with the physician to ensure that that it's getting better. And then the 3rd zone is the red zone, which is bad and requires immediate treatment. If the patient doesn't get any better after the medications or doesn't return to the yellow zone, then they should probably go to the hospital. The patient should also understand how to properly use the inhalers, and it's important to take the prescriptions as prescribed. A great way to ensure that the patient understands the teaching is to have the patient demonstrate how to use the inhalers and then verbally explain to you why it's important to take the medication as prescribed, and how to use the inhalers again. And then as a nurse too, it's probably important to teach the patient how to calm down, or teach relaxation modes like deeper breathing, slower breathing, even practicing yoga, just ways to reduce their stress, anxiety, and be calm. And then some resources for asthma would be, the CDC has a lot of great recommendations. Even the Environmental Protection Agency has a lot of stuff on their website, because of the pollutants or air condition, or the air quality. There's an American Academy of Allergy and Asthma, Allergy and Asthma Network, American Lung Association, the Asthma and Allergy Foundation. So just surfing the web, or going to the library, there's a lot of good information that people can find. And then there's asthma disparity work groups, which help address preventable factors that impact disparities in communities and for minorities, and the less socioeconomic areas. So yeah, that is my presentation, and thank you.